Hello everyone, my name is Jenny Richards and my slideshow is going to be about a genetic chromosomal condition called Trisomy 18, also known as Edwards syndrome. What is Trisomy 18? It is a chromosomal condition caused by a genetic mutation where there are 3 copies of chromosome 18 in the cells of the body instead of 2 copies. There are 3 types or severities of Trisomy 18. The most common type, or the normal type, is when there are 3 copies of chromosome 18 in each cell of the body. The second type of trisomy 18 is called mosaic trisomy 18, where there are only some cells in the body that have 3 copies of chromosome 18, meaning there are some normal and healthy cells and some affected cells. The third type is partial trisomy 18, which is when there are 2 copies of chromosome 18 in the pair, and the extra third copy of chromosome 18 is attached to a different chromosome pair that is not chromosome 18. This is the only type of trisomy 18 that can be inherited. Symptoms during pregnancy can include low fetal activity, meaning not much movement in the fetus, having a small placenta, having only one artery in the umbilical cord, or polyhydramnios, which is when the fetus is surrounded by too much amniotic fluid in the uterus. Symptoms found post-birth include congenital heart disease, which is a defect in the heart structure present at birth, kidney disease or kidney failure, respiratory failure or breathing abnormalities, hernias, which is when an internal organ pushes through a weak spot in the muscle or tissue, or scoliosis is when the spine is curved. There are some physiological changes that are present at birth that include low set ears, overlapping fingers, club feet, small physical size, and abnormal function or formation of internal organs. The main risk factor is having a geriatric pregnancy. A geriatric pregnancy is a pregnancy that occurs when the maternal age is 35 years old or older. The risk during pregnancy increases as maternal age also increases. Since this is a condition diagnosed at birth or in utero, there are no risk factors that can affect the progression of the disease. Trisomy 18 is more common in pregnancy. However, the majority of fetuses affected do not survive to full term. The frequency of the disease in pregnancy increases with maternal age. Trisomy 18 in pregnancy occurs in about 1 in 2,500 pregnancies. Within the live-born infants, trisomy 18 occurs in about 1 in 5,000 infants. It cannot be inherited for the most part, with the exception of partial trisomy 18. Since it is a genetic mutation, it is completely random in frequency. It is very unlikely that a mother that had a child diagnosed with trisomy 18 to have another child diagnosed with the same disease. Trisomy 18 is a very severe condition with a very high mortality rate. Almost 40% of fetuses that survive the 3rd trimester do not survive during labor, and 1/3 are delivered preterm. The survival rates of babies diagnosed with trisomy 18 are 60 to 75% their first week, 20 to 40% their first month, and 10% past their first year. Within the children that go past their first year of life, they are able to live life with the full support of their families. However, they will never be able to learn to walk or talk. In a normal and healthy human, there will only be 2 copies of each chromosome in each cell of the body. However, in trisomy 18, there are 3 copies of chromosome in each cell of the body. This genetic condition is very severe and in most cases lead to death. There are many cardiac, kidney, and respiratory complications that affect the body, as well as neurological dysfunctions, as the child may never be able to walk or talk. The main 2 diagnostic testing done during pregnancy is amniocentesis and chorionic villus sampling. Amniocentesis is the sampling of amniotic fluid during the 15th and 20th weeks of pregnancy. CVS is a sampling of the placenta between the 10th and 13th weeks of pregnancy. Both tests will be taken to the lab to run tests that will confirm any genetic disorders. CVS also confirms the sex of the baby. The image on the left is amniocentesis and the image on the right shows CVS. Diagnostic testing done post-birth include heart examinations and blood tests. Heart examinations are done because the majority of neonates with trisomy 18 have heart-related problems. Blood tests are done to do genetic testing to confirm diagnosis. Since the condition is completely random with no genetic inheritance, there are no ways to prevent this disease from occurring completely. However, one thing that is known to help decrease the risk is to not have a geriatric pregnancy. Women that are older during pregnancy tend to have a fetus or child diagnosed with Trisomy 18. There is no known cure for Trisomy 18. Since the condition is very severe, most infants that make it to full term and are born are provided with comfort care rather than treatments to help with the condition. However, by the severity of the condition, there are treatments available for the infant. Some treatments include cardiac treatment, assisted feeding, and orthopedic treatment. This will be the end of my presentation. Thank you and have a wonderful day.